that when it comes to trying to determine how things are returning back to normal, we don't just want to just throw you back at home and say everything's fine now. We want to be able to institute a program, essentially, that will help us determine how well things are doing once you are at home. And here's what I mean by that. When we issued that directive was primarily designed for people who are smelling these odors and getting these daily symptoms and finding them unbearable that they have to leave their homes. Now, we can't be sure, just because the well has been plugged, that all those odors are not going to go away, immediately. They may still linger. There may be still conditions up at the site that may emit some of these chemicals that still may cause odors in the community. So we want to make sure that we are monitoring for that phenomenon if it should occur. So what we're developing right now, and I can't give you all the details on it because we're still working out the details on it, but we're trying to develop a system within our public health department that will allow you as community members to be able to report to us in a real-time fashion when odors may occur after you move back in, the characterization of those odors, whether those odors are still causing any symptoms, and it'll be basically a program that we're going to develop that will work essentially by text message. So you'll be able to send us that information and let us know where and when it's occurring. We can get GPS coordinates and we can get real-time data essentially about why odors are occurring, when they're occurring, and how often they're occurring. And so what we're going to do is we're going to identify what we call key informants. So we're going to ask for essentially volunteers. From you, we'll come back to other community meetings and get other volunteers as well, so that we can have people all over the community who essentially are spread out enough so that it covers the entire map of the community to allow us to use your information as you transmit it to us to determine what's going on with odors. Now, if everything in the first few weeks after the incident is closed up and we don't get any odor complaints, well, great, that'll be awesome. But we still may get odor complaints, we just don't know if that's going to be the case or not. So we are going to develop that system to have you, to essentially help us help you help us determine whether or not these odors are persisting in the community, because that's where we want to get information directly from you as opposed to any other methodology. So at the end of today's presentation, one of my associates, our lead epidemiologist on this, Carrie Taylor, will be over the door here. And if you want to volunteer to be someone who will transmit that information to us as you move back in, looking around your community, smelling your community, and trying to determine if these odors are still there, you can leave your information with her, name and contact info, and we'll get back to you as to how we can use you for that aftermath period where we determine whether or not odors are truly going away or not. All right. So that's a lot of information, but I want to make sure we got through that whole presentation so you have a good understanding of where we've been and where we will continue to be after the gas leak has been plugged. And I know we've got a couple of other presentations as well. I think we wanted to hold our general questions until we're done with everybody so that we can all come up here and answer the questions. But thank you for your time.
Thank you, Dr. Langdon. And we are going to now hear from several other members of the county departments. I think Jeff Reed from our Office of Emergency Services has a couple of quick messages, and then we're going to hear from our fire department. So, Jeff?
Angelo, thank you. So I'm with the County Office of Emergency Management, and we've been cooperating and coordinating with the Los Angeles City Emergency Management Department on the scheduling of a local assistance center, and that will open as Dogger confirms that the well has been sealed. We'll open that local assistance center, and that will be a one-stop location for all government services, both city and county, and some of the private sector partners. So if you need any of those services, need to arrange any things to be turned on or off, or even mental health services, we'll have the Department of Mental Health representatives there. That they'll be available at that one-stop local assistance center. And also, the other speakers tonight have mentioned about the Small Business Administration Declaration, economic, injury, disaster loans available for the businesses in the community that were impacted by the leak. And that application process, there'll be further information coming out about that as well. And I want to reaffirm to you what the supervisor said, is that we're in here for the long haul. When we have a disaster, the recovery period has a very long tail. And my office and my other partners here within the county are in for that long haul until you're all back to normal. So with that, I'll be around for any questions that you might have.
Thank you, Jeff. Dr. Rangan wanted me to remind everybody that we do have a fact sheet about returning home, and there's some very useful information on there. I wanted to next go to the fire department, and just before I introduce our next speaker, just acknowledge that the incident commander for the fire department is in the back. That's Chief Pena back there, Vince Pena, and his staff. And the deputy incident commander for the fire department is our next speaker, Bill Jones, Chief Bill Jones.
Thank you, and good evening, everybody. I just wanted to let folks know a few things that the fire department's involved with and where we're going from this point on. First of all, we continue to operate under unified command and basically manage the activities every single day, weekends included, on what's going on up there. We have, as was mentioned earlier, a lot of resources up there, and we're typically involved with planning and preparedness so that anything that might happen, we're prepared for. So if somebody gets injured up there, we're prepared to take care of them. If somebody needs to be air vac out, we've put together contingencies for that. If something happens where an evacuation is necessary, we've long had a plan with LA City Fire and LAPD for an evacuation. So these are the kind of things that we continue to look at and review on a daily basis, make sure we're up to speed, make sure we're vigilant in what's happening in that respect. The fire department also has a component within it that deals with hazardous materials, especially for businesses that operate in Los Angeles County. The Health Hazardous Materials Division has been a partner in many of the activities going on with the collection of samples, the determination of where the samples should be taken from, the type of analysis, and the interpretation of the analysis. And we continue to do that. We're also involved with the hazardous waste issues that might come out of this entire incident. How is the hazardous waste being handled? How is the stormwater being handled? Are there contingencies in place to take care of stormwater runoff from this location? So we're out there looking at what's set up. We're out there in the rain as it's occurring, making sure that these things are being handled and that we're not having any secondary impact from the hazardous waste or stormwater or other things related to the hazardous materials that occurs up there. And another thing that we've been very involved with is there's a lot of agencies involved with this incident, as you can imagine, both at the local, the state, the federal levels. A lot of agencies that want to know what's going on, they want to be updated. We've been having routine meetings with what we call cooperating agencies to keep everybody in the loop, to make sure they're involved or at least knowledgeable about what's happening. And as you can imagine, there's a lot of people that are reporting to their principals, whether it's in Washington or Sacramento, and we're trying to facilitate that exchange of information so people are all on the same page. The other thing that we're looking at very closely is what the scope and extent of our involvement will be after the well issue is resolved. And there's a lot of concern that has been raised recently about when is it the right time for people to move back into their homes. And so we're looking at a lot of those factors as the health hazmat component of the fire department to determine what kind of things we need to address and what kind of things we need to do in order to bring ease to the residents as they start moving back into their community. The other thing is we're also monitoring and managing any fire risks that are up on the hill. And essentially, we bring in resources to augment the fire brigade that's up there for the company, as well as the medical folks to make sure that when there's a red flag warning, which we've had over the last so many days, that there's a commitment on the part of the fire department to bring in extra resources in case something were to happen. So with all of that, we're heavily involved with a lot of the things that you've heard already, and I think we'll be continuing to evaluate exactly what we need to do to get to the next level, to the next stage, if you will. As Dr. Rangan said, when this thing is eventually capped or this thing is resolved, there's a lot of work that may be going on afterwards, and we're going to be partnered with that. So I appreciate the time and being able to come up and tell you about that. Thank you very much.
Thank you, Chief. I think at this point here, now that our county team has made their presentations, and it's probably time now to just take questions, and members of our team will be happy to answer them. Yes?
Okay, I have a question for the doctor. With the chart that you had on the benzene levels, I understand I'm not panicking about benzene, but I do have a question about the distribution between the low and the high is pretty big. And you're using averages and you're making conclusions based on averages. And I haven't looked at the frequencies, so I don't know what the distribution of that is. But I know that the high is half of what, or a lot closer to something of concern than the average.
Right.
A big difference.
Right. So when it comes to what we estimate in terms of your daily exposure, the averages are the better way to look at that. But you're right, when you look at the ranges, you've seen a lot of ups and downs, no question about it.
Averages versus the mode, like where the most frequent?
Right, yeah, so looking at medians instead of means and things like that.
Exactly.
Yeah.
I mean, I don't want to get into a whole statistical discussion,
Right.
but that's a huge range.
Right. So we're actually going to be looking at it in a number of different ways, and we sort of need enough data in order to do this. But the averages are the first way you look at this, but we're also going to be looking at it in terms of what we call 95% UCLs, upper confidence limits, and things like that. And then we're going to basically be looking at it and then plugging it all into a computer to determine what potential long-term health risks there could be. So we're still not worried that we're going to reach a point where we're going to say, oh my God, there really was a long-term health risk that we didn't know about. But we do need more data in order to make sure that we can conclusively say something about
And
those
I guess my
implications.
question is the more data that you're looking at, are you paying more attention to that high than the average? Like,
Right.
I might be looking at those areas where you're a
Sure.
lot closer.
Right, so when we play with these numbers, what we're going to be doing is we're going to be very conservative about it. So we're going to be looking at those highs and we're going to say, okay, let's pretend these highs were high and stayed that way. Instead of, where the next day it may have come down, let's just say, okay, let's ignore that. Let's pretend it stayed high and say what would be the case if it did remain this high. So we'll get theoretical with that, no question about it. Just want to see what the possibilities would have been if those levels remained as high as they did.
Before we go on with more questions for Dr. Rangan, I'm sorry, I neglected that we have with us here Cher and Jason from the Air Quality Management District, and they had a brief presentation as well. So Cher?
I'm sorry.
And then we'll get back to the questions.